So good afternoon. My name is Anna Duncan. My pronouns are she, her, hers, and I'm a program operations specialist here at the CoLab for Community and Behavioral Health Policy in the Evidence-Based Practice Institute. On behalf of our team, I want to say thank you so much for being here today, especially during a lunch break. We're really appreciative of you spending your afternoon with us. And we're very excited for today's webinar, which will explore complex situations and providing family-based and culturally responsive interventions for child and youth mental health care. We will start with a land acknowledgement. CoLab for Community and Behavioral Health Policy and the University of Washington acknowledge that we gather on Indigenous land, the traditional territory of Coast Salish peoples, and specifically the Duwamish tribe. This ancestral land is unceded and must be returned. We also acknowledge that our work across the state takes place on the homelands of Native peoples who have lived in this region from time immemorial. Currently, there are 29 federally recognized and 7 non-federally recognized tribes within Washington state. We express our deepest respect for and gratitude toward these original and current caretakers of the region. As we move forward in advocating for and moving toward health and racial equity, let us remember that we're living in a history-driven present. Let us work to learn more about the histories, cultures, and traditions of Indigenous people and how we might build relationships with sovereign tribal nations and create more inclusive spaces that foster innovation, collaboration, and empowerment. We encourage you to consult native-land.ca to learn more about the land you are on and to pay rent through Real Rent Duwamish. The Duwamish tribe has yet to be justly compensated for their land, resources, and livelihood. And by paying real rent, you can do something today to stand in solidarity with First Peoples of this land. All funds go directly to Duwamish Tribal Services to support the revival of Duwamish culture and the vitality of the Duwamish tribe. Before we begin, I'd like to go over some brief Zoom housekeeping. So if you encounter any technical issues during the webinar, or you just want to express thoughts or reactions to the speakers, please send us a message through the chat box, and we welcome general reactions here. We will have a Q&A session after the presentation, so we just ask that you hold your questions until the end. And during Q&A, feel free to pop your questions directly in the chat, or you can use the raise hand function, and we can call on you so that you can share your question verbally. Lastly, we just ask that you pay special attention to keeping yourself muted unless you're asked to unmute by the presenters. So thank you so much for being mindful of that. And as a reminder, this webinar will be recorded and it will be uploaded to our website. At the end of the webinar, we'll send an evaluation survey link through the Zoom chat. And we would love if you could fill it out with any feedback you have so that we can continue to improve our webinars and make them useful and meaningful to you all. We'll also send out an email with that link and with the recording, so you can fill it out later if that's easier for you. And when you're filling out the evaluation survey, we would love if you could share additional topics you'd like to see us focus future webinars on. Additionally, once you fill out the survey, you are eligible to receive a free certificate of completion. So this may or may not be eligible for credit through your field's specific continuing education organizations because they all have different policies, but we're really happy to provide you with general documentation of attendance and completion. All right, so before I turn it over to our first presenter, we're just going to quickly look at the live poll results. So it looks like we have about 71% of folks here are in the mental health field, which tends to be a common thread in a lot of our webinars. And it looks like we also have a big chunk of folks in social work, and then kind of a sprinkling of others in policy, research, and advocacy. So it looks like there are a lot of folks doing kind of direct clinical service in the room. So thanks so much for sharing that. All right, so again, I want to thank you all so much for being here. We at the CoLab for Community and Behavioral Health Policy are really excited to host this webinar. And as previously mentioned, today we will get an overview of how to approach complex situations and family-based interventions for child and youth mental health care. And for those of you who haven't joined us before, the CoLab for Community and Behavioral Health Policy was founded in 2020 within the Department of Psychiatry and Behavioral Sciences at University of Washington School of Medicine. And here at CoLab, we aim to engage community expertise and research evidence to spark creative and sustainable change in behavioral health policy and systems, particularly those involving youth and families. And for today's webinar, we're really excited to feature these two amazing presenters, Jim Theophilus and Claudia Pineda. So to give a little bit of background on our first presenter, Jim Theophilus has been serving the children, youth, and families in Washington State for over 40 years. Jim is a state licensed mental health counselor and a certified chemical dependency counselor here in our state. He's worked in multiple residential and outpatient treatment centers, and also has operated a private practice where he works with families, individuals, and couples, as well as providing clinical consultation to other professionals. Previously, Jim founded the Mockingbird Society and Away Home Washington, and more recently in 2021, he founded North Star Advocates, which continues his work of supporting and strengthening young people, families, and communities as a strategy to prevent and end youth and young adult homelessness and system involvement. So without further ado, I will hand it over to you, Jim.
Hi there, everyone. I'm really grateful to be here. Excited to be with you, and want to start by thanking CoLab for inviting me and express how honored I am to be on the same platform with Claudia, who I'm excited to hear from as well. And I really want to start by thanking all of you, particularly those who talked about being in mental health, but any of you that are on the front lines of what I call the battle, the war to save children, youth, and families. And I think for some of the families we serve, it is a battle every single day. So I know what it means for you to be on the front lines. And so as trite as it probably sounds, a brochure talk, I really do hope you have your own, not just self-care, but joy plan for the holidays coming forward and ongoing. So when we talked about complex, I have to say, given kind of the world we live in today, I'm not seeing very many families or folks who don't feel like either they're presenting as complex or that their world is complex and what they're struggling with is complex. So I don't say that to minimize. I'm going to do my best here today to talk about some of the families I work with. And who I try and help them find their next best place, whatever that means for them. But I also want to say that even those families that look like they're doing okay, particularly after the pandemic in particular of being locked up in their family together, we're all sort of struggling. However, when I do sort of embrace the notion that some families do have a bit more complex set of dynamics that they're facing. And again, I want to make sure that I'm clear that I see them as facing the dynamics, and that's what makes them complex. It's not that they are a problem in and of themselves. It's more of how they are responding to what the world and what life brings them. And so with that, I have a one-liner that I use as a guiding post that I literally repeat to myself, and I would have a couple of these throughout my talk. When I'm in the middle of a session, when I may be feeling imposter syndrome or overwhelmed or what the heck do I do? And that one-liner here is the definition of a situation. If it is real in its consequences for that person, then in fact it's real. And so that makes sure that I'm taking judgment out about, again, are they embellishing? Are they exaggerating? And that's particularly true in the first set of complexity that I always make sure, and I'm grateful that I had early training in working with folks who experience, and I'll use some clinical terms. I hope you know that I use that structure, but that's not how I treat folks. But typically Axis 1 diagnoses, those diagnoses, those situations where someone is in fact experiencing some psychosis, either fluid psychosis or soft emerging psychosis. And so I think it's hard sometimes for families and many of us to sort of understand that they're hearing things, they're seeing things that I'm not seeing. But I think most of you are sophisticated enough clinically to understand that still is real for that person. and to engage in sort of convincing them it's not, is not only harmful to them, but we lose credibility as change agents, as a support agent. But there's also those less blatant examples for the situation in the adolescent who is feeling like everybody in the family is against him or her. It doesn't do me any good to start that conversation by convincing them that the fact they have food on the table and ice cream in the freezer, that somehow their parents really love them a lot. It goes better when I listen to what that experience is like for them. And that's particularly true with some of the young people I'm working with who are on the autism spectrum or who have some neurodiversity sort of challenge. It's not unusual for families, and this is for good reason. But when there is typically a child who has some complex features such as developmental or intellectual disability, again, some kind of emergent psychosis. And this is always challenging with adolescents because we may not even know that that's what's behind the behaviors and the mood swings, is that there's an emerging bipolar or some level of disorder that's emerging, but not yet been either diagnosis or present enough for us to understand what it is. I think that definition of a situation is really, really important. Another dynamic that I face that I would put under the complex category is individuals who are involved with the court system. And that puts the therapist, I mean, at least I experience, there's always something that the court wants from me, a statement that this person is safe in the community, this person has done something. And that's an extra dynamic in the therapeutic relationship, in my view, in that it's not just going to be contained in this office. And the client has typically signed some kind of paperwork that says Jim will report out. And so one of the ways I handle that, quite frankly, is to let the individual know that I am, they're going to read anything I send to the court before I send it. So I do want to be transparent there and accountable. But mostly I'm going to just simply write down whatever that individual presented in the therapeutic process. If they came to every session and they were on time, if they participated, if they engaged with the issue at hand that the court's concerned about, that's what I'm going to write. If you come to my office, and I don't have an office anymore, we're in the telehealth thing, but if you come to the appointment loaded as a dump truck, 20 minutes late and yelling at me about why you shouldn't be here, you know, if that happens sometimes, I understand it. That's part of the process. If that's all that happens, then you're going to have to help me articulate how we present that to the court, because I am not going to lie to the court. There's other complex issues that I face. In fact, two of the families that I'm working with now, and this is how it typically works. I'm sure you know that I got one referral from someone who knows me, and then we did pretty good with that family. And so then another family who talked to them sort of came my way. But this is an adolescent who actually the first one this time last year was in Mary Bridge Hospital in Tacoma, and was not able to get a room because they were overcrowded. And so this young person spent 2.5 weeks handcuffed to a gurney in the middle of the ER hallway, waiting for a room, and parents refusing to pick him up. And so I'll own that the first time, and I've had some experience with this, but it still was like, oh my goodness, right before Christmas, they're not picking up, and this kid. And when I talked to the parents, all of that was dispelled. They are really loving, hardworking parents who are really, really, really overwhelmed, have asked for help many, many times. And sadly, in this system, particularly for poor folks, and I think for families of color, often the only way you get help is once the child is either arrested or comes to the attention of CPS or some system involvement. But to just flat out be able to proactive, and I get these calls from grandmas all the time. I've been asking for help for 6.5 months. Now that he got arrested, I got POs and nonstop case managers. So I did have some of that, but this is a young man who had caused over $15,000 damage to the family home. There were no doors on any of the rooms, including the bathroom, because he had broken them down, and they'd replaced them and broken them down. Siblings were afraid to come home. because of the volatility and the violence that would ensue. So I would consider that complex. A couple other quick examples are around family secrets, whether they're generational or, happening in real time. Certainly infidelity is an example of that. I always remember when I had one family come in, white, pretty wealthy family, had a history of being able to sort of buy themselves out of almost anything. And this time it wasn't working with their 8-year-old child. But I'll never forget this. I met all three of them. And then the mom asked, can we meet with you alone? And I rarely like to do that, but said, okay. So the 8-year-old had some toys, but put her in another room. And so a long story short, the mom basically said, we've already decided to get divorced, but it's so close to Christmas. We want to have one last good Christmas. And so we talked a little bit and left. And then the 8-year-old came back, and I declare to God, this is the truth. After talking to the 8-year-old a little bit, who was mainly referred for cheating at school, was at a private school, and so was cheating apparently. But one of the first things she said to me is, I want to tell you something, but you can't tell my mom and dad. So I'm like, oh, well, here we go. And she said, we're all going to get divorced, but we want one more Christmas together. And so here's an example to me of what I call the wisdom of the unconscious and the wisdom of children, where I don't know if someone told her that or if she just sort of knew it or picked up on it. But there's where we had this sort of secret that was dividing the family, but that they had organized around. Of course, domestic violence, major addiction, other issues are examples of complexity. Other kind of things in the ecosystem that I want to say is, again, this pandemic has wreaked havoc on many of us, and particularly those who do have some high anxiety and or psychosis. I mean, it's an invisible germ. We're all anxious as heck about who's got it, how do I get it, do I hug, do I leave my house, etc. And then I really think the climate change discussion is another environmental driver, no pun intended, that is really causing a lot of anxiety for the adolescents that I work with. And I will be honest, I think I was protected by some of my age. Well, if the world's going to come to an end, or 20, 50 years, where will I be? Of course, I worried about my adult children, but I'm recently a grandpa. And so what I will say about that is, all of a sudden, I am feeling more invigorated by life and also more vulnerable to life. And all of a sudden, even though I don't want to say I didn't take it serious, I've always been concerned about climate change, but not on the existential level that I now experience having a grandbaby. And so I think that existential challenge for young people is really, really strong. And then we have to factor in the social and racial justice issues. I'm working with a mixed family now. And one of my first questions is, how has racism impacted what you're all dealing with? And how could it not? How could it not? The anxiety of the dad when his young son goes out of the house, the anxiety of the son about whether can I really be honest in this classroom about how I'm experiencing this conversation, not just with the teacher, but my friends on the soccer team, et cetera, et cetera. So what I try and do with that complexity is at least create a safe space to sort of knock on those doors. I often bring up things in the first or second session, like, have you ever been sexually abused or whatever? Very rarely do people tell me, or are they honest about it? But what the signal I want to send is, I can talk about that. This is a place to bring that issue. Jim can tolerate that. And I think that's one of the first sort of questions, conscious and unconscious, that clients have. And I know I had when I've been in therapy is, before I give you what's in here, I want to see how you handle some of this other stuff. And so that's part of what's important to me. I will spend a few minutes now on theoretical framework. I do think diagnosis is important. I do not follow the medical model per se, but I do believe that if someone has been evaluated, I at least want to read that, see what it says. My experience with diagnosis is sometimes they're helpful. I'd much rather create a prognosis than a diagnosis, because I think all too often diagnoses particularly adolescents, sort of experience that as a life sentence. I've got this thing. I'll always have this thing. There's nothing I can do about this thing. It's the number one thing that anybody who knows me talks about. My teacher asked me, am I taking my meds? My parents asked me, am I taking? So it becomes this organizing agent that I want to help them demystify. But quite frankly, I do want to know what kind of issues have these folks already talked to somebody about, and how have other professionals viewed them. But again, I let them know right off the bat that it is not a life sentence. But there are some things, if I have a 62 IQ, that's probably not going to grow significantly over my lifetime. If I do have schizophrenia, I probably, as far as I know, there still is no cure per se. And so it is then about helping folks understand what we can do with that. How can we challenge the limits? How can you have a full life? But accepting what's there. So in terms of some of the theories I use, particularly with families, I am a high subscriber to systems theory, because that allows me to both address the individual, forgive the term, identified patient, is what the literature would call it. Who are they coming here to sort of work with? But it also allows me, from a systems view, to look at all the other subsystems, the sibling group, the parental hierarchy, or the guardian hierarchy, because many of the families I work with, the parents may or may not be primary caretakers. It might be quite frankly, often women, a grandma or an auntie. But it allows me to sort of roam through there. It allows me to talk about and talk with the whole family, because typically what happens is the adults, again, for the ease of conversation, the parents or guardian come to me and they either say it directly or imply it, but they want me to fix this kid. They just want me to fix that kid, and then they want to go about their life. And the systems theory allows me to sort of say, we've all got some contribution into how things are going, and let's look at that. From the adolescent's perspective, most of them do not want to be there. I will say I've had a handful of adolescents who have come to me voluntarily on their own. And quite frankly, they have all been young people who are homeless or on the streets, and they heard my name or saw me at a drop-in center and had, they're often, I talk about them being age 50 at 5, like they are so parentified, they've had so much trauma, and now they're on their own. They have to sort of grow up quicker in a way that has its own consequences in different ways. But they have come to me. But mostly the adolescents that come to me, they're being drugged, pulled, cajoled, threatened to come and see this guy. And so one of the first things that I talk about with the adolescent is sort of, what is it you want out of this? And almost always the answer is to get the F out of here. And so to me, that's awesome. That's our first beginning of a contract, because I do believe, and I use the term contract loosely, but I do have to know what it is folks want and where they want to go in order for me to help them get there. And for a 15, 16, 17-year-old or anyone to say, I want out of this process, I can, then what do we got to do to make that happen? Here's what the courts expect. Here's what your parents expect. In fact, one of my first one-liners is, I want to help you fire me. So I want to challenge their perspective. Most of them come and think this is going to be some time warp experience where, my God, again, I'm going to go in there and I'll never get out. And who is this guy? And I'm going to be in a room or on a telehealth, which I'm really interested in and find fascinating in some ways about how to do this work over the web. But again, there's a lot of legitimate anxiety that, again, I have when I go to a therapist and meet them for the first time. So I talk about, how can you fire me? What are the hoops you need to do? What are the behaviors you need to address that will convince whoever that you don't need to come here? The other thing I tell adolescents is, I make a contract with them that if it's not working, I will tell their parents it's not working and you should either stop this or go find someone else. And so, but to make that agreement, I usually say you need to be here, and I pick the number depending on who the young person is, 6 to 10 times in a row. And if we meet 6 to 10 times, 6 weeks in a row, for example, and it's still not working, and the most important thing you want is to get the heck away, I'm going to support that. And I do. And there have been times where I thought it was working. I think they had to admit some of it was working, but they still wanted to exercise that clause of the contract where Jim said, okay, it's time for a break. And I will tell you this, more often than not, they end up coming back within a handful of weeks or months. And the young person is even more motivated because now they're coming back much more clear on what the experience will be like, much more clear on what it is they want to work on, and under their own motivation. They are not being pulled or pushed or threatened to be there. One of the other things that I really look for early on with families is we have this thing in our culture, reward and punishment. And most of us, when we are threatened, it seems to be something in the water that we drink as adults, that what we want to do is take away from kids. So I can't tell you how many times a young person who had a passion, a hobby, something in school that they loved, sports, choir, whatever. And the first thing the parents start saying is, if you don't do X, Y, Z, if you don't behave better, if you don't stop doing that, you're not going to be able to participate in whatever that passion is. And I really, really, really strongly counsel parents to stop that. That if anything, you should be taking them to hopefully something healthier than McDonald's, but doing something positive for them when they complete that. In other words, I want to follow young people's passion. I want to follow and embrace what it is they find exciting and that gives them some excitement in life, and not allow that to be weaponized, if you will. The other thing I'll say is money is often an issue. Many have insurance. Some come to me with coupons. I rarely take the state coupons because it's not worth the paperwork that I have the time to do that. So, but what I do, whether they have money or whether it's complete pro bono, is I will often charge the adolescent 1 hour a week of volunteer time as a way for them to pay for this. And again, I start with the passion. So one young man I'm working with now is just totally, he's on the spectrum, totally into skateboards. And this kid could take apart the wheel bearings and change it, and all this intricate stuff that he was telling me about that was completely over my head. In mechanical technology, I say I'm still proud to work in Etch-a-Sketch. So I was grateful I got on here in time, right? But this young man absolutely had some clear expertise. And so one of the things, his first hour was to do more of the skateboarding. So he's, again, challenging his perception. He thought I was going to have him go down to the Navy shipyard and clean all the bilge off the side of the ship or something. But no, you get to decide what that hour is. I was working with a Native American family a while back, and they did come with a coupon. I didn't want the coupon. I said, I will charge you. There was 5 in the family. The youngest was age 8. I charged each one of them an hour that they would give back to the community in exchange for my work. And the 8-year-old was the most excited about that. So it's also a way for them, they can join with each other. You know, at some point they were doing kind of volunteering and going to the food bank together. But it's just another way to sort of have some conversation around what they have to offer. Everybody has something to offer, is my view, no matter what the diagnosis or the situation is. And this is a way to not only pay your bill to me, but to give back. So other theories I use are cognitive behavioral. This is particularly true for some of those diagnoses. Again, I want to say one of the biggest concerns I have about young therapists, and I'm consulting to one right now who's just absolutely amazing and wonderful and doing great work, but has not had enough experience with psychosis. And so was working with a client doing visualization, empty chair exercise. And there was a crisis at the end of each session. And part of it was, I think she did not realize that is not the approach for somebody who is already has a psychology framework that is just too loose. And they're trying to sort of organize about, am I hearing that voice from my therapist, or is that my auditory, my inner voice? And so when we do things that open all that up, it's just too much stimuli and not enough organization. And so I really encourage her to stop doing those interventions with this particular client and be much more concrete. And I will say at the end of each session, one of the things I do is help clients sort of reorganize. So the structure of my session is typically a little bit of warm up, happy talk. What's the work for the day? What do you want to focus on today? Or this is what I remember from last week. We do whatever we do. Sometimes it's really life changing, and sometimes it's like, what are we doing here? Right. So it's the spectrum, but always with about 5 to 10 minutes late, I try and help that client, no matter who they are, what I call reorganize, get ready to go back out into the real world. The bus driver doesn't care how old you were when the cat had puppies. They want you to pay the money, sit down and shut up. And so the real world doesn't have the same tolerance or patience that you get, hopefully, when you're in your therapist office. So simple questions like, so what are you going to do after this? Where are you going to go? What's the rest of your day? Do you have any idea what you're having for dinner? It's just little things that ground us all in sort of getting out of our, forgive the term, touchy-feely, woo-woo sort of aspect that's critical to good therapy. We have to explore that. But again, trying to help folks go back into the role. And that's particularly true after a powerful session where someone may be crying and emoting and memory retrieval and this sort of thing, how to sort of reorganize that person. And if there's really some of that where they're working on major trauma or recovering from historical trauma, then there's always something that we agree on early about. So when you're done with this session, what are you going to do? And all too often the answer is go back to work. And I'm like, well, is there a way to have 10 minutes to just kind of walk around the block before you get in your car, to just, again, reorganize so you can go back to work and do what that world expects of you? Couple quick constructs, 5 minutes left. Oh, it goes so fast. I guess what I'll jump to is these are the holidays. And I do think it's important to check in with clients about how the holidays are going. Many people need safety plans. In my own family, one of the things I was going to say is what makes me credible to talk about complex families. And I say, well, come to my family Christmas Eve sometime, and that'll answer everything. But one of the things that I know with my own children when they were young is when we went to a family event, if there was a particular, I knew it was time to leave when a particular uncle brought out the whiskey bottle. The beer and wine was okay, but so that's an example that I give to clients. And when will you know that it's okay to maybe distance? What if that person that did those bad things to you shows up unintended? What's your safety plan for that? Suicide assessments for those who have had history or some challenge with that. But the other thing I want to say, my clinical experience with the holidays is most folks sort of hold their breath and get through it. I tell therapists to really pay attention in January when all the hoopla is over, the presents have been put away, the tree's gone, and now there's this kind of understandable letdown for all of us to some degree. But if you've been white knuckling it, holding your breath to get through all of this stuff, that's really where I've had more clients talk about moving from ideation, suicidal ideation, to genuine gestures and or attempts. So I'll close by just saying I try with my clients to be fair, firm, and fun. I try to be honest. I try to make sure they get a message that they can run their symptomatology and whatever challenges are in their life. Their symptoms don't have to run them. But I will close by saying programs don't change lives. Policies don't change lives. Relationships change lives. And our relationship might be when I was in the emergency room at the hospital, it might be a 30-minute assessment. I still have a relationship there that I want to support this client. I don't want to overdo it. I always want to make sure their primary relationship is with the people in their community, in their family life, in their personal life. But then some of our relationships are more long-term. Again, I close by just saying thank you for what you do. I know it's hard work, particularly in those offices or those screens. Sometimes we feel very much alone, and are we being helpful? And there's no greater gift that I know of for me than being present to a child in need and helping that child or young person sort of move forward, including their family. Thank you.
Thank you so much, Jim, for that wonderful presentation. And next, I have the pleasure of introducing our second presenter, Claudia Pineda. So as a first generation Mexican, Spanish speaking queer social worker, Claudia has supported families and youth in complex situations as a direct practitioner for 10 years. She's also worked at the policy level in local government, where she developed and informed policy that impacted youth and family service provision. She's now an independent contractor and partners with organizations and institutions providing training and organizational development. So I will hand it over to you, Claudia.
Thank you so much. Hello, everybody. I'll make my intro short since we have such little time. I just want to reiterate a few things that Jim said. First of all, thank you all for having me here, and thank you for the collab for inviting me. Second, thanks for doing this work. I just want to remind you all that the work that y'all are doing is so imperative, and it's easy to lose. I think the gravitas of the impact that the work that you're doing is having. And when I left that field, I started to get more of an appreciation and just like recognizing how much I think own cheerleading we have to do to stay in it and to stay grounded. And that if you're not doing the work, then who is? I just want to acknowledge that this work is really difficult. And because of that, I think that I want to share with y'all some of the lessons that I have seen the most effective people in the field that they were able to implement, and same the things that were the most helpful to me during the time that I've been doing this work. So if you'll switch slide for me, please. I want to talk about specifically 5 particular areas. And for me, doing this work, I was the most effective when I was grounded in myself. And what was the paradigm that I brought to this work? I'm a person, so it ebbed and flowed. And sometimes I was at my highs, sometimes I was at a low. But I know that I was the most grounded when I saw myself as something bigger. And what I mean is that I wasn't the expert in the room, right? I'm not the one that's here to save or rescue people, especially because most of the people that I serve were Black and brown. Who am I to come in and fix Black and brown youth, right? I can't fix Black and brown youth, but what I can do is be the change that I want to be, as cliche as it sounds. I am part of a community. So if I am strong in my community and we can build community together, that is when I am strongest and the most effective. So I reimagine myself as being one person in a part of a greater scheme. And what we were doing together was cultivating community. During the time that I cultivated community, I focused on the different kinds of things that I can be doing. So as a social worker, yes, there was always the intervention that I had at hand, but also what was the bigger picture in which I was. So there was myself, the connection, the relationship that I had with the client, the technical skills that I applied when I was working with a client, whatever the client, whether it was a youth, a child, and or their family, whatever it was that they were going through and what their world looks like, but also, my community. And when I say community, I'm talking about the people that were around me. So like my coworkers, but also the people in other organizations in my circle. And then next, the system that supported the infrastructure in which I was in. So a system can mean anything. It can mean the organization that I work for, or it could even mean like the policy, state, government level forces that were at play. So if you'll switch to the next slide. There were some things that I asked myself often that helped me develop the more and more that I was involved in this work. So earlier I mentioned this cliche, right? Be the change that you want to see. How can I help Black and brown communities if I'm not strong myself? So what were the ways in which I needed to grow? There was always room for improvement. I know that there's, this discouragement from using the terms always and never. For me, this is an exception. I learned that there is always room for growth, no matter what. I also learned that I've never arrived. So I've never gotten to a place where I know everything, right? And I just want to pause for a moment in these kinds of questions because a big part of my work grounds in race equity work and in racial critical analysis. So for me, a lot of these things are interconnected, right? So like as a person who is working to dismantle racism and to heal from the effects of racism, um, I've never done enough work. Like I said, particularly when I'm working even with Mexican people. I identify as Mexican, but there's so many privileges that I have in relationship to other people within my own community. And there's always that room for the self-reflection. How do I respond when I'm challenged? So whether it's a youth, saying F you to my face and or being violent, right? Sometimes in the session, how is it that I'm responding and reacting? And, whether it has to do with somebody that I work with, who am I when those things happen? When is it that I become defensive, right? Whether it's in session and or working with youth. One of the circumstances in which I worked with youth is when youth were violent in their homes. So that brought up a lot of my own triggers and a lot of my own biases and preconceptions that I had to work through. I was not violent as a young person. So for me, a lot of times it was like, well, why don't you go to school? Or like, why are you being disrespectful towards your parent? And it was catching myself and reminding myself that, how do I not allow those things to come up in the session with a young person, but instead, what is it that I have to work through? What are my own biases that are keeping me from connecting with this young person? So all of these challenges that I experienced were things that presented in my line of work, like every single day. So I would invite you to ask yourself, what are the challenges that are recurring in your own workplace that come up over and over that lead you to a point of getting frustrated and or saying, you know what, I need to grow beyond this paradigm or beyond this one thing that frustrates me. What is it that's getting in the way? And then how often do I proactively ask for feedback? And I'm talking about all across the board, like from the young person, from the families that I work with, from my colleagues, from my supervisors. Like I have not met more than a handful of people that do this work that are continually asking other people around them, like, hey, what is the impact of the actions or what is the impact that I'm having on you in the relationship? Just continually, because they're genuinely interested in learning. How do I engage in those uncomfortable conversations? Am I proactive or do I just wait and only have uncomfortable conversations when it suits me? Yeah, so, all of these questions, I hope that we can share these slides afterwards, but they're just ongoing conversations that I had with myself on a periodic basis of reflection of asking myself, where am I? And the idea isn't when I say that there's always room for growth, it's not about saying like, well, you're never going to be enough, but it's holding both truths at the same time simultaneously, like that I am enough. As a professional, I am enough. I can help people, I can help myself, I can help my community, but at the same time, I can also grow, right? How good am I at asking for help and how healthy am I? Because if I want to create a healthy community, I can't do that unless I'm healthy myself. So we can switch over to the next slide. Here are some ideas of some things that I grounded in to cultivate myself. One of the things that I've done a lot in my professional experience is I'm a trainer and I have trained many youth workers to work with youth. So these are some of the things that we worked on in our sessions, and it's so challenging to do this in such a short amount of time. Otherwise, I would love to do workshops with you where we develop a leadership statement and ask ourselves, who is it that I'm accountable to at the end of the day? Am I accountable to my colleagues? Am I accountable to my community? What does that look like very specifically? And what are the frameworks that I ground in? When I started as a social worker, I was really overwhelmed because there were so many tools. And the reality wasn't like, how do I get really good at grounding in 10 different tools, but how do I pick one or two and ground in those? And then how do I get back on track when I fall off? So because this work is so draining and overwhelming, it's okay. We're all going to fall off. But what is it that I do to get back on? And how do I hold myself accountable? Right. Um, and, again, it's kind of like sometimes being my own therapist, but also going to therapy myself, right? But being my own therapist in the sense that I say, just how I have intervention plans for youth, I can have an intervention plan for myself. So what are the personal things that I'm working on? Every year I do like a collage where, I put down my goals, and then periodically I check back on those goals and ask myself, how am I doing in terms of the areas in which I want to grow? And then it's not enough to just try to keep myself accountable, but what are the learning communities that I'm a part of? So if we can switch over to the next slide, I want to talk about community care as well. So there's different questions that I have on here about like community relationships. So it's so important to be doing this work. Like if you're doing it in isolation, the chances that you're going to harm yourself and that you're going to harm the community are pretty high. Because none of us can do this work in isolation. We can't be healthy that way. But what does my community of support look like? And if I don't have one, how do I create one? So who do I go to for reframes, advice, consultations, and mentoring? So I need to find people, whether they work with me or not, that are going to challenge me, that are going to teach me, that are going to show me, and at the end of the day, that are going to remind me. One of the things that I was thinking about as I put these things together is that it's really intimidating to try to talk to a group of 69 participants of people that have all kinds of experience and education. I don't think that I'm teaching y'all anything new. I think that what we need is reminders of things that we already know. So who is the community that reminds us of the things that we already know when we need it the most? And do I have people around me that love me, that can give me critical feedback when I need it? Right. So not just somebody that says, yeah, you're right. Yeah, that youth and that, family was out of line, but somebody that says, you know what, I hear you, Claudia. I hear that you're really challenged with this young person. And what would it look like if you also thought about it this way? Right. Um, Again, another question is, if we're trying to help youth, have better relationships with their families and with their communities, well, ask myself, how well am I doing with the people around me, whether it's my colleagues and supervisors? And then the next thing that I'll talk about is going back to what Jim was saying. I think it's so important that at the end of the day, what is it that we're trying to do is like advance the self-empowerment of people. You don't want them to be dependent on you, but how do they reconnect to their natural and local supports? So like there were many a times where I felt challenged that I'm not working with people who are Mexican and immigrants. And so if they're from other cultures and races or ages, or if they're boys and young men and they can't relate to me, well, maybe it's time to refer them to somebody else somebody else who's better equipped. Or sometimes people just need more than me to go. Again, I'm not rescuing and saving these folks. I'm helping folks recreate the community that they need around them. And sometimes it's just remembering to go back to people that have already been in their lives that they've been alienated from. So a lot of single parents, right? They have other male adult figures in their lives. Maybe there's an uncle, maybe there's a cousin. And I think that this work is sometimes so difficult so that we forget, right? That we forget that it's easy to think that I'm the only one that's doing this. But in reality, it's how do we connect people back to their natural supports? And then how do I get connected to those natural supports and remind those natural supports that they're important and they have power and that they can really impact the young person and the family, and vice versa, remind the family that those people are important, those relationships are important to keep in the lives of young people. Will you please switch to the next slide? Something that Jim said, I read in a textbook one day and it hit me the most. It was when I was in grad school, and it said that something about there had been a lot of studies done that less important than the actual intervention that you use, the single most important factor in making an intervention successful is the relationship that you have with the client. So how is the client connection? Over the years of doing this work, I've watched how other people work with clients, and I've seen this like just lack of warmth, that I think in grad school, I think my thesis paper was written about like how to connect with Mexican American families. And towards the end, my advisor and I were just reflecting on how she said, at the end of the day, all you're saying is be a nice, kind human. Um, I don't know if y'all have heard, but like Mexican folks are super warm, right? Like you come to their house and they're like, here, have some food, have a shirt, have a chair, sleep in my bed. So what does it look like when you're greeting your clients? And that has been really successful for me, not only with Mexican people, but with people who are white and people who come from different countries and people from different racial and ethnic backgrounds, is like just coming in and asking, how are you? Hey, it was cold. How is the weather? How was your drive here? And part of the introspection is asking yourself, if you're from the Pacific Northwest, we're not known to be warm folks. So what does it look like for us to change our demeanor sometimes and match the warmth or match the culture of the people that are on the receiving end, right? So as I watch people sometimes work with others, it's like they see them, they're like, great, they sit in their office, they pull out their computer, they pull out their uh, clipboard and start taking notes. And I'm like, hey, you're talking to people. And I just want to remind folks that not everybody went to school and knows all of the things that we know about, like, this is how you're supposed to have relationships, and these things are appropriate and these are not. These are the boundaries, these are not. Man, the folks that are on the other end just want to know at the end of the day, do you care about me as a person? And I think that is the one thing that young people have responded to the most in whatever I've had to say to them. I've said very difficult things to young people, but if they know that I'm coming from a place of genuinely caring about them and their well-being, I can say whatever, at the end of the day. Um, so that's where I've been successful in being very direct, concise, and clear to young people. And they will respond and they know that I'm coming from a place of respect, because guess what? I also help their mom pay the bills and or get food and or, meet the basic needs that the family was also confronted with. So how often am I inviting engagement? I can't tell you how many times families say, I don't want to bother you. I don't want to bother you. So I have to respond with saying, it's not a bother. It is my job to help you. Call me a million times, call me 5 times, call me 10 times. And I got to be responding to those calls. It can be one time that I don't respond to somebody's call and they can say, you know what, Claudia doesn't pick up her phone. Right. So how responsive am I? How able am I to adapt my style to meet the other person? So like that example that Jim was giving, hey, like there's something that's clearly not working for the client, right? So if something's clearly not working, if every time that I do this or I engage with the person in a certain way, can I adapt? How flexible am I? How willing am I to change? And finally, how often am I asking my clients for feedback, but in a genuine way? Will you please switch to the next slide? When it comes to technical skills, y'all, again, I used to go to a lot of trainings thinking that I was going to learn this like magic intervention or ask the question. And something that I learned is that like when I worked with the most difficult youth, which were youth that were in at the youth services center in the jail at King County, these would be youth that came in with like really long rap sheets and that were like some of the most dangerous kids, and therefore they had to be incarcerated. And I would hear from their parents, and their parents would talk to me about how violent they were. I was often intimidated. And I was like, well, who am I? Like, I'm not even a parent. Like, how am I going to help this young person and or this family? Um, I'm not like the best clinician in the world. And you know what? I can't tell you how many times a safety plan and like a basic CBT curriculum would be at the end of the day what would help that family. And like Jim said, a lot of these folks would be people who were constantly like calling the cops and having had asked for help and having gone to all kinds of places. But in 6 months I would just stick to a safety plan and go back to the safety plan over and over again. And before I worked at that program, I used to think safety plans were a joke. Having been a person myself who has struggled with suicidal ideation throughout my life and experienced a lot of violence, I thought that safety plans were a joke. And it wasn't until I started working there and I actually started to have conversations with young people and their families and like really believe in the safety plan myself and then just keep going back to the safety plan, um, that I actually started taking them seriously because they actually work. And again, with the CBT skills, I mean, you know, I implemented a 6-month CBT curriculum that was just really basic, man. Just like, how do you use I statements? How do you apologize? How do you listen? How do you use assertive communication versus passive communication? And so it wasn't about finding the perfect intervention. It was more so being consistent, developing trust, and, staying on course over time. But what I saw a lot of people is get scared and overwhelmed. So every time that they confronted the same situation, they would throw out what they were trying to do before and then try something new, try something different. But if you stick to the skills, you got to remember that young people and children are changing and we got to give them a million um, chances and times to mess up, if you will. And our systems don't necessarily work on the timelines of families and youth. But if you can keep those kinds of expectations front and center, I think that's what's important. I think strength-based affirmations are also very necessary. Even though there's a lot of conversation about that, I don't see it happen very often in practice. And again, it goes back to clinicians themselves feeling uncomfortable doing it. But if you are sitting with a young person and you're not affirming every strong thing that you see in them, um, every session, it's going to be hard. It's going to be hard to really develop that rapport. And I can't tell you how powerful it is. I had a grown man, in tears after one session of just affirming him for the strengths that I saw in him because he said that nobody had ever done that before. And it's so powerful. Will you please switch to the next slide? And then finally, my most recent job was at King County, advancing the zero youth detention policy when it came specifically to working with complex situations. And yeah, we need y'all. We need y'all in the systemic place. We need y'all challenging your workplaces, and we need you voting, and we need you to, all of you to pick a cause, pick a few causes, pick a few leaders of color in your community and support. Make the calls, write the letters. And, if you don't know what the right way is, that's a perfect opportunity to put yourself to the side. When I first moved to Seattle, there were a lot of things that conflicted me about the kinds of conversations that were happening in the community that I had a really hard time with. But something that I had to continue to remind myself was that leaders of color that were doing this for longer than me knew better than me. So I stayed engaged in the conversations and I asked them a lot of questions and I just kept supporting them. And guess what? Later I realized that they were a lot wiser than I was. And that if I had just believed that Black people, Black, queer women who had been doing this work were intelligent and had something to teach me, that I could defer to them, maybe I could learn something and I could actually help the community instead of, trying to center myself and see myself as being the rescuer and the savior. Yeah, I think that we need all of you, and I'm so grateful that you are doing this work. And I really appreciate y'all giving me the opportunity to share today. It's challenging to be in this because I don't really normally like to talk at people, but I like for our sessions to be more interactive so I can understand what kinds of challenges y'all are going through so I can tailor my questions and my answers to your questions. But for that, we have this Q&A session coming up, and I would love to hear if there are any specific questions that y'all have. Thank you.
Great. Thank you so much, Claudia and Jim, for those incredible presentations. So we have a fair amount of time slotted for Q&A, as Claudia mentioned, and we would love to hear, either through the chat box, or if you want to use the raise hand function to ask about kind of, either specific clinical situations that you'd like feedback on or to talk through, or, like broader questions about their presentations and the content. So we can start with, I know we'd had a question in the chat for Jim, so we can start there, and then folks can continue to add in questions or use the raise hand function. So I'll just read it out loud for you, Jim. So you've been working in the front lines of mental health and substance use. Do you have any wisdom to part with, even if the systems are listening? You've earned the privilege to speak on matters of public policy, and I would really like to hear your vision for the next 40 years for those who will continue to be working within the system.
Well, first I want to say thank you to Claudia for sharing and what I learned from you. And I don't know if our paths crossed, but I was the clinical director at in the mental health clinic at King County Juvenile Detention for a while. So to the question, well, first of all, I don't know that I know about 40 years, but I will say to the question of whether systems are listening, I will say mostly not voluntarily. They have to be forced to listen. And I think it is true, the one-liner that we've all heard, systems are doing exactly what they're designed to do. A lot of my work over the last many years, since before I founded the Mockingbird Society even, was around the foster care system and the juvenile justice system. And I think in many ways they're pretty much the same. It just depends which system captures the child, the adolescent. But we know that the history of the foster care system is founded in, and I don't go here lightly, but is founded in white supremacy of taking babies, Native babies, Black and brown babies from their families and communities. And so I think we have to understand how that history shows up today, and it does show up every day. I think some of what I'm hopeful about is there has been some kind of reckoning, a lot by the advocates, quite frankly, broader than child welfare advocates, the social justice advocates. But we had a handful of bills passed last session. So to get to the point and then sort of give the bills, I think we have to look at this foster care system and say, they have $1 billion budget to take care of other people's children. And then what happens is those children end up with 5, 10, 15 different placements. I often say that the foster care system is, and please, I'm not talking about the specific foster parent or the specific social worker. This is where people sort of get activated, like Jim's saying, we're bad and we don't care. I'm not talking about those of us who are toiling the soil every day in the system, although some of them definitely are part of the problem. But I'm looking at this macro system, and I'm looking at how many of these kids end up in homeless. So I'll go back. The foster care system, I've said it in front of the legislature, is a feeder system to send adolescents to the commercially sexually exploited piece, to the criminal justice system, to homelessness. When I started Mockingbird, if a young person got their GED or high school diploma and turned 18, they were out of the foster care system that very day. And I'm sad to say the way I learned that is I joined a party for a young person. And because he had gotten his GED, but he turned 18 a month before that. And literally the foster parent came up with the black garbage bag and said, okay, you have to get out because we can't keep you after today. You're 18. I mean, it's that cut and dry. So we had a couple bills passed this last session that really put a higher burden on the department before they remove a child, require that there be a visit with family immediately, like we tried 24 hours, we got to 72, require that before they place with a stranger, and again, foster parents hammer me for using that term, I know they love, many of them care and are doing a good thing, but I don't care. If that child is 8 years old, 5 years old, 15 years old, the first time they go to that foster home, they're going to strangers, as opposed to this new law requires that the state really do due diligence to find a kinship placement, relative or informal. I don't ever call it fictitious because there's nothing fake about those relationships. Many of us have had an auntie or an uncle that we learned when we were 15 or 16. They're not really blood auntie or uncle, but they treated us and they were part of our family. So I think there's some hope in some of the legislation around how do we strengthen families, keeping families together, rather than the go-to move being for removal, which is outrageous. I hope that answers it.
Thank you so much, Jim. Does anyone else, I'm not seeing any questions in the chat, but anyone else have any other questions? Feel free to unmute. Oh, perfect. I see one. Okay. So I'm seeing this as a direct message. So this is for Claudia or Jim. So maybe if Claudia, you can start, and then Jim, if you have additional thoughts. What recommendations do you have for kiddos living in rural communities where the lack of resources in general are staggering? So great question.
Yeah, that's a super great question. Again, I would think about what are like the natural supports and the way that that young person can create community. So again, it's like I'm thinking about if I'm not centering myself as the rescuer or saver of this young person, and I'm not going to be around this young person's life for the rest of their lives, how am I promoting for that person to create that system around themselves? And so I think y'all know about the power of having like 1 or 2 people that a young person can go to, 1 or 2 adults. So maybe it's sometimes starting there, right? Is there 1 or 2 people that you care about, you know, in your school or in your family that you can start with? And then with the peer connections as well. When I think about the experiences I had as a child, there were adults that I could go through, but what kept me alive were my peers. And I wasn't the most popular kid. I'd never liked really hanging out with like 20 kids at once, but it was always having like one person that I could feel safe and go to. So I think that as difficult as it is to, you know, find the organizations and the robust services that do exist in the inner city, that's one response. And then I'll also share that there's a lot of organizations in the city and in more urban areas that know that this is a problem. So like partnering with those organizations. I'm thinking about like Young Women Empowered, which is an organization that I've been associated with for many years now. And they know that this is an issue. So they will go anywhere in King County to pick up a young person to ensure that they can come to programming. So what kinds of advocacies that those people that are in this room are also providing so that the systems and the programs that they're developing have that kind of infrastructure where you can pick up kids and or pay for their transportation.
Yeah, I think that's a really great answer. I will just pile on by saying, you know, I really have so much empathy and even cross into worrying sometimes about the young person who identifies as queer in a rural community. I think that is incredibly isolating. But I think there's work to try and get resources there, but I don't have any easy answers. I think Claudia said it around how to create some relationships. How is there one relationship you can be honest with? And this is a place where maybe the social media can help. It's very risky in other ways, but I think maybe being able to know your world is broader than the 2 farms down the road. I want to take a quick second, if I can, to also kind of plug something that this group may be interested in, which is I'm starting a coalition / program that will begin in January. Of the systems of care, foster care, juvenile justice, the Office of Homeless Youth Shelters, and behavioral health inpatient, 2/3 of the kids that come out of those systems that are homeless within 6 months are coming out of an inpatient treatment program. Now, I have to say that really breaks my heart, because the courage it takes for a young person to go inpatient, whether it's for mental health and or chemical dependency, is just absolutely, it takes a lot of courage. And then they're discharged to a drop-in center that has no beds on a day it's not even open. And we've got 2 examples where young people attempted suicide right in front of that drop-in center. So I'm starting a coalition to try and bring discharge planners together with housing providers so we can actually customize discharge plans that is driven by the young people themselves. And so I just put a plug, if any of you are interested in joining that work. I think it's going to be exciting. And I think it goes to the prior question about how can we sort of fundamentally change some of these systems and how they behave. Thank you.
Great. Thank you so much, both of you. And it looks like, so we have another few questions. So it looks like the next one is for you, Jim, and then we'll follow up with another one for you, Claudia. So Jim, you talked about the reality of some diagnoses having permanent impact. Any recommendations about having the conversation with parents about schizophrenia and or ASD, IDD, creating a new expectation for the parents?
Yeah, I've had those conversations. That is not a fun thing to tell a parent. And we know that some of the symptoms become florid between 18 and 25. So this is a young person who may have done, had a great adolescence. I mean, not perfect, but in the zone, so to speak. And now at college is having their first decompensation break. I think that for me, that's another, I'll go back to the family systems theory. I try when I'm meeting with families, I do genograms all the time. I don't know if you know what genograms are, but that's how I take notes. And then sometimes they become bigger to sort of see for the family what sort of the generational patterns are. And often there is mental illness involved in that. So some of it plants seeds there, but I think the thing, just to be honest, is it's a direct conversation about this is what looks like is going on with your child. Sort of share with them that there's going to be a lot of grief and loss, but there's also this is not a death sentence. It is amazing the difference between somebody who has that issue, that disease today, than even 30, 40 years ago. I know the medications are not perfect. They have side effects. But I will tell you that it's a lot better prognosis. Then there's the challenge that the individual has with their medications. And I got a young 18-year-old I'm working with now who's AMA from an eating disorder clinic who is trying life on her own. And her family is absolutely aghast and withholding resources. But it's like she needs to try this. And how can we put some support around her so that she gets to try it? Not because that's what I want for her, but to Claudia's point, I'm not rescuing her. I can't change that. She's going to do this. And so the hard question for that family is, are you going to really withhold resources, keep her ID, not allow her to get into a decent program, housing program, which almost forces her to the streets and can predict decompensation? So those are the kind of things that I help families sort of understand, that you still have choice and it can get a lot worse. And how do you want to sort of look back on this thing about how you showed up at the beginning? So I think that to answer the question as direct as I can, compassionate, empathic, honest, admit what I don't know, connect them with other families who's gone through it, like they have a new community and a new thing. And there's a lot of shame and stigma for some folks, so they have to sort of deal with that. But then back to the genogram, there's often generational ghosts that come back. So they might have known about an uncle or a grandparent or somebody who had kind of just disappeared and then came back or went to the institution. Like it will also challenge sort of not only their perspective of what's life like today, but again, it will bring up some of that generational grief and trauma that they likely are going to have to shake the hand of that ghost in order to be present to their child in a good way.
Thank you so much, Jim. For our next questions for you, Claudia, can you elaborate on how you found safety planning to be helpful, either as a technical skill or anecdotally?
Sure. Thank you for the question. So, I learned how to use these when I was working in the anti-violence field. And it is a piece of paper because there's that material symbolism, and you fill it out with the person, with the client. So first you ask them to identify what are the warning signs, right? So what are the feelings that come up? What is it that you're feeling in your body? Like what's going on? And so sometimes that requires a lot of conversation, but you're helping the person become more self-aware, and help them understand that it's not about trying to intervene like when things have blown out of control, but it's more what is the prevention, right? What is the buildup? Because I think that many times people think that there's not a way to control themselves. But the reality is that what you're helping folks understand is that this happens in a greater picture and to stop the pattern, right? The next thing you can do is identify like what are coping strategies. And the family has to be supportive of the coping strategies too, because sometimes, they're not. Sometimes the parent like wants to intrude on the space. So it's a conversation with the parent as well and being like, hey, when the young person says, I need a timeout, timeout looks like I'm going to go to my bedroom and you're not going to follow me into my bedroom. So there has to be the agreement, right? That everybody's going to respect what that looks like. However, you also have to come back, right? So it can't be like, I'm just going to go to my bedroom and not talk to you for 2 or 3 days. But the cool down period, there has to be an agreement around that. I need 15 minutes, right? I need an hour. And then also identifying what are some supports that people can use and being really specific. It's really helpful to be smart, if you will. And by smart, I'm talking about be as specific as you possibly can, like as time oriented as you can. You want to make it really realistic, because you're setting up the client for success, right? So you also identify like, well, in the event that maybe you need somebody to talk to, who are those people and what are their phone numbers or what are their email addresses, or how can you contact those folks? And then if I don't respect the contract, this is what the consequences will be. And again, it's a conversation that everybody comes up with. It's not like a punishment, but it's like there are usually consequences, right, to what happens when something doesn't happen. So like, for instance, my mom is going to call the cops, right? I might end up in detention. I might end up in the hospital if I don't. And again, it's a matter of revisiting this piece of paper so that it's not only a sheet of paper. And in the heat of the moment, parents often forget. Sometimes I've had parents that, like will call the cops. And then once the cop is there, they're like, look, the safety plan wasn't enforced. And then it's having a conversation with the parent, right? Of being like, that's not how a safety plan works. It's not like you call the cops and then you have them enforce the safety plan. It's about a matter of the young person having agency and taking accountability and you helping the young person. And then also, as a practitioner, legitimizing that sheet of paper and then not expecting that it's going to be perfect. It takes some tries, right? It's going to be like, okay, it didn't work this time. Is there anything that we need to modify, or should we just keep the safety plan as is and we'll just try it again? So again, we also have to have grace and modify our expectations based on the young people. They're gonna need some opportunities to mess up, and that's okay. When that question came up, I just looked up a really quick template on safety planning. I'm just going to post a link here. This one is specifically for self-harm, but you could modify it to the situation that is being experienced.
Thank you so much, Claudia. Any other questions from folks? We'll give it a few more seconds in case there are any last questions.
Can I say something while we're waiting, just to add to the conversation? One, it's a very old book, and it's I think in today he might rename it, and you've probably heard of it, Man's Search for Meaning by Viktor Frankl, who survived the Holocaust and Auschwitz, and so the first half of the book really talks about sort of his experience, but the second half, and it's not a theory I've ever seen really get much exposure. He called it logotherapy, logo theory. But the gist of it is, and I've used the sort of the nugget, if you will, that I learned from that, which is his contention is it's not always the trauma, but it's what meaning do we bring from that trauma. And so, not that that's simplistic. I don't start with clients necessarily with that, because we all need to necessarily go through a process to get there. But nevertheless, at the end of the day, there is something about what can I take from this and strengthen my life, strengthen people I care about life, my community's life. And it fits with one of the things that we used to say at Mockingbird when I started is, yeah, we want to change this foster care system. We want to get rid of this damn foster care system in many ways. But we're not just doing it for you as a 16, 17, 18-year-old. We're doing it for that 5-year-old child that doesn't even know she's going to face foster care. And I will tell you the impact that has on the young adults, the adolescents, that they now had a different way to organize that trauma. They had a different way. They had some meaning to help someone coming from behind. And so that's another thing I try and do, is help folks find how they can participate in their own meaning, and that this trauma, well, I would never say is a good thing, but what can you do with that for those you care about and come behind you? So that's another genuine philosophy that I try and have in my own life, but also, forgive the term, a strategy to help other folks sort of figure out how to organize this trauma as I go forward. Insight is often not enough. There's got to be some other way to sort of move forward.
Very powerful. Thank you, Jim. And it looks like that resonated with some folks in the chat as well. Well, I think just giving a time check and wanting to be respectful of everyone's time, I think unless there are any last questions, we will kind of transition to the end of our webinar. So if we want to go to the next slide, please. So here's the contact information for incredible speakers. And so you will get this slide deck emailed out to you as well. So please know that you don't need to write it all down in this moment, but just feel free to reach out to them if you have additional questions or thoughts or would like some consultation. And then Jim, it looks like, what was the name of the book? Oh, perfect. Thank you. Wonderful. So I just put in the chat our survey. So we would love it if you could take a moment to fill that out either now or in the next week or so. But just want to end by thanking you all so much for being here and for the thoughtful questions for our presenters. I think I learned a lot just from this Q&A session. So we are now going to end our 4-part webinar series on family-based interventions for child and youth mental health. So thank you so much for being here today. Thank you for many of you who have been here throughout the whole presentation series and for sticking with us through all 4 parts. We hope you've enjoyed it and have learned something from it. And as a reminder, this will be uploaded onto our website, which is uwcolab.org, if you'd ever like to rewatch it or share it with other folks. And again, please reach out with any other kind of questions, thoughts, or feedback. And I hope you have a wonderful rest of your day.